Navjot Singh Bajwa, serial COP Jagadhri. Also, we have traditional Indians in serial COP. Please also like it. Yeah, see here. Maybe Navjot will tell us.
कुछ नहीं चाहिए हेडफोन तार वाला
Hello, Prabjot, are you there?
Hello.
Hello, yeah. Aditya Kaushal this side. Yeah. Yeah, Aditya. Yeah. Hi, Abhimanyu. How are you? I'm good. Thank you. Okay, got it. Yeah, Abhimanyu, sorry to interrupt you. Is this Sahil Dhiman an authorized person to speak? Or do we have to mute him? Okay. Okay. Okay, fine. Palak, please switch off your video and audio.
Okay, sir.
Cool. Cool. Yeah. Yes, I'm here. I can hear you. Great. Okay, no problem. Okay. Hi Devkant, how are you? Yeah, hi Devkant, how are you?
Hello, fine.
Are you hearing me?
Yes.
Okay. Okay. We are going to start within 5 minutes. Yes, I'm here. Yeah. I'm not getting you.
Hello.
Hello?
Addy to begin.
Hello? Hello?
We can hear you. Go ahead.
Yeah, I hope that I wish that everyone can keep their audios and videos off so that I can start the session now. Because still there are some interruptions. Yeah, Abhimanyu, thank you. Thanks a lot for giving us such an invitation for here to give you a webinar. So, hello everyone. I am Aditya Kaushal, LM Indian Red Cross Society, CEO and founder of International Institute of Foreign Studies. I hope everyone is safe and sound at their house during this pandemic. Well, you know very well, Indian Red Cross Society is an international humanitarian organization which was started in 1920 in India. We have completed our 100 years of excellence and achievement in this year, 2020 in India. Well, let's come to the point. A kind of problem is going on throughout the world nowadays, which is COVID-19. So before going to the point, I want to start with a general statement that uh, everyone is having problem in their lives. I do have some problems. You also have some problems. But what is the main concept here? We don't see throughout the problem. We just see a small fragment of that problem. Okay. So let's talk about COVID-19. We have around 69,000 active cases. Remember, I'm saying active cases in India. Okay. And nearly 3,700 people have died so far till now. And we have 1,24,000 something cases reported, which are being confirmed yet. So let's talk about 10 days back. 10 days back, the average increment of the cases were 2,000 cases a day. Sheikh, excuse me, guys. Sheikh, could you switch off your audio and video, if you don't mind? Yeah, thank you. So we were having 2,000 cases a day, which has now slightly increased. And now we are getting 4,000 cases a day, means the proportion has been doubled. Means before we were getting 2,000 cases a day, and now we are getting 4,000 cases a day. So what our mind is going to make a conclusion, you know very well. Uh, Guys, please switch off your audio. Okay, so our mind is going to make a conclusion that Corona is spreading a lot. Cases are increasing. Am I right? Yeah. So is it true? Yes, undoubtedly it is true. However, this is not a complete picture which you are looking. The complete picture is something else. Well, we will see through another aspect of Corona, which nobody is going to tell us, not even media, not even the government, no one. And I don't think so it is the right time to criticize about anything. Let's come to the point. Well, if you look 10 days back, 10 lakh people were tested. 10 lakh people were tested. So there were around 40,000 cases. So the average is 4%, means we were having 4% people suspected, or we can say found positive. Guys, please switch off your audio. Okay, thank you. Okay. So now what is happening? Around 10 lakh people were tested before 10 days back. And now what is happening? 1 lakh people are being tested every day. Means 1 lakh people are being tested every day. Okay. So in the past 10 days, 10 lakh people have been tested. Means 1 lakh every day. So 10 lakh till now in the past 10 days, if I see. So they have been tested. So the number of cases have become doubled, around 70 to 80,000 cases we have right now. Okay. I'm not talking about the confirmed cases. Remember, again, I'm talking about the active cases. Active cases. Okay. Actually, the cases haven't increased. This is the point. Please understand. The cases haven't increased. Testing has been increased. We have increased the testing. Sorry, okay. Is it fine? I have switched off the video due to some error. Okay. So, where I was, yeah. So the tests have been increasing. So if the testing is going to be increased, we will think that the patients are increasing. Okay. Unfortunately, no one is going to talk about the number of tests increasing every day. They are just talking about the patients increasing per day. Even they are not telling people, the media is not telling people that these much are the confirmed cases which we have, and these are the active cases which we have, and these are the recovered cases which we have. They are just creating a panic among the citizens. Okay, so leave it. So neither the cases are increasing nor the virus is spreading. Okay, nor the virus is spreading. So now we have to calculate that what the actual number, like how much the cases we have actually right now, like what the actual number is, which we can assume. See, we don't know who is suffering from corona, who is positive. We don't know. Either you, either I don't know, because we haven't get tested yet. Okay, and the ratio of testing is very low. Still, it is very low as per our population of our country. It's around 135 crore. Okay, so the data which I have here on my table it is showing that 4,000 cases are being reported every day. That 4,000 are increasing every day. So today there are around 20 lakh tests done. So the cases are 80,000, 60, 70 to 80. Okay. So the percentage is 4%. So simply what we will do, we will multiply 135 crores to 4%. So we get around 5 crore 40 lakh something. So let's make it 5 crores only. But this is not the right way. See, if we multiply it, we get that these are the people who are suffering from corona. But still, this is not the right way to calculate. Like few days back, government has divided the parts of different states, different cities in the different zones, red, green, and orange. So we can have an idea from that these number will not consider 80% of people. Why not 80% of people? Because we are not going to consider the rural India. Okay, because I think rural areas are not that much affected as the urban areas are affected. Okay, so we will minus 80% from 5 crores. So we will get around a number of 1 crore. Okay, it will become 1 crore. So on the most conservative side, we can assume that we have around 1 crore people positive from corona right now. Okay, so 1 crore people we have. I hope you understand. You are the medical students. 1 crore people we have, and we also have to understand this, that the multiplication which is about to go in future from these 1 crore people cannot be stopped. We can't stop it because we can't keep the cities locked for a long. Sakshi, please switch off your video. Whoever is there on the screen, kindly switch off your video and audio. Thank you. Kindly switch off your video. Okay. So on the most conservative side, we have around 1 crore people suffering from corona right now. And this multiplication is not going to stop, not by us. We can just make some efforts. Our medical teams are just going to make some efforts that, yes, they can handle the situations, but we can't stop the multiplications. We can't stop in our houses anymore. This is a bitter truth for us. We can't stay anymore in our houses. We can't continue the government cannot continue the lockdown anymore, because we have to see about our economy also. Everything is going to be happening. So the data which I got from the Ministry of Health India yesterday, it was showing that 41% of people are recovering from corona. The rate is 41%. Okay, I'm speaking all about the data. Okay, so if I speak about Ritu, please switch off your audio. Please switch off your audio, video and audio both. Thank you. So, what you will think from this number, from this term, 1 crore, you are going to think, oh my God, these are the cases which our country have. Guys, please turn off your audio, please. Thank you. So, what you are going to think, oh my God, there are 1 crore people suffering from corona. But what we have to understand from this angle, it is very, very positive for our nation. This data shows that we have achieved the herd immunity. Congratulations, guys. We have achieved the herd immunity. And I'm just saying all these things due to the data which I have, due to the calculations which I have done. Everyone is spreading negativity about this disease, this pandemic. But you are the medical students, and this is your social responsibility to make people aware, to spread positivity among the people that the corona is not going to kill you that much. It's not that much easy because we are the Indians and we have achieved the herd immunity. I'm not saying that you can take it lightly, but still I'm saying we have achieved the herd immunity because the death ratio is very low in India. If I compare, if you also compare, because we have 135 crore people living in India. If I compare it with any other country in the world, what you will find, the least ratio of death is in India. I'm saying about the population. Okay, so the least ratio is in India. So why? It is very good for us. Excuse me. It is very good for us because right now the only solution of this problem is herd immunity, as I told you before, because it is not possible to extend the lockdown. We can't do anything. Our teams are doing good, our medical teams are doing good, but the lockdown cannot be extended anymore. And the cities are still partially locked down. Things are still going good. So, and the bitter truth is this virus is not going anywhere. We are not sure when the vaccine will come. We are not sure when it is about to go from our country or from this world. So the bitter truth is this: we have to learn how to live with corona. Okay, we have to learn. I know you know very well. You have to use sanitizer, whatever. Everything is available on Google. But these positive aspects, I think, these are all about your mentality, which you are thinking about this pandemic. So herd immunity means when the major number of people will suffer from this virus and will develop when the antibodies will develop in their immune system to fight this virus, the spread is not likely to continue. Means, if I speak in Hindi, कि जो spread है वो नहीं बढ़ेगा अगर major number of people को ये बीमारी हो जाती. Okay, if the 70 or 80% of population will suffer from this disease, it is unlikely to continue. Then, Sakshi, please switch off your video and audio. Thank you. So, just to give you an idea, if this virus was not there, if I go back 6 months back, every month, 6 lakh people die in India due to different diseases, different viruses. 6 lakh people every month. Remember, 6 lakh people every month. So, I'm not saying there was coronavirus. There was any other virus which triggers any other disease in the body of the people who die every month from different diseases. The data which I have is clearly showing that people who have died from corona, people who have died of corona, were more than 60 years of age. 80% of people were 60 years of age. Okay, मतलब जो 80% लोग थे वो 60 साल से ज्यादा थे, 60 years से ज्यादा एज के थे. And one more thing which no one has told you, that they already had any disease. They were suffering from diabetes, they had any other disease. I don't want, the list is very long, so I don't want to mention all the things here. So what the corona did, corona ने क्या किया? कोरोना ने उस डिजीज को ट्रिगर किया, जो भी उनको डिजीज था उस डिजीज को कोरोना ने ट्रिगर कर दिया, जिससे उनकी डेथ हो गई. आई एम जस्ट सेइंग 80% of people, around 3700 people have died so far, so I'm talking about 80% of them. So जरूरी नहीं है वो कोरोना से उनकी डेथ हुई है, it could be a normal virus also. Okay, so the question arises is why the death ratio is less in India. What is the reason behind it? So there are plenty of reasons, but the biggest reason is this: the major population, like 90% of people in India, are of less than 60% of 60 years of age. Okay, मतलब जो 90% जो लोग हैं इंडिया के वो 60 years से कम एज के हैं. Okay, please switch off your audio. Vivo 1803, whoever is it. Okay, thank you. Fine. So, and the second reason is this: our immunity is comparatively strong as compared to Western people. If I talk about any other country like US, Italy, Europe, if I talk about all Europe, Western means Western. Okay, so as you know very well कि जब भी कोई भी foreigner जब वो इंडिया में आते हैं, what happens with them? जो चीजें हम खाते हैं और अगर वो उनको खा लें, so वो बीमार पड़ जाते हैं उस चीज से, और हमें को फर्क नहीं पड़ता, हम जीते रहते हैं फिर भी, because our immunity is very strong. Okay, so because already हमारी country में there are number of viruses and number of infections are there, और हमें उनके साथ रहने की आदत पड़ गई है. ठीक है, so our body is already immune to stay with those viruses and bacteria. So reason could be scientifically proven or not, I'm not sure about that, but the truth is the death ratio in India is very low. It is the lowest in the world. It means we can achieve the herd immunity easily. Some people have achieved, some people can achieve the herd immunity easily without putting pressure on our medical system. It is not necessary to put a pressure. Very good afternoon. It is not necessary to put pressure on our medical system. Okay, so it's my humble suggestion for you all that we have to think about herd immunity now, which is the only solution for this. Either we are going to take precautions, we are using masks. I'm not saying you don't have to use masks. Yes, you have to take care of it. You have to use sanitizers. You have to stay healthy. You have to stay like clean and hygienic. Your houses must be clean. But the most important thing which I want to request to you all, the government of India, to everyone, whoever is watching me, that we have to achieve the herd immunity. We have to improve our immunity. And guys, you are the future of this world. You are the future of this country. And this is your duty to spread a positive message among the people of this country, of your area, or wherever you live, or in your community, that it is not a big deal to fight with coronavirus. We are Indians, and we have gone through various things in our life. And our parents have also told us that there were worse situations as compared to now. So we can easily cope up with the situation. And thank you for that. And now I would like to invite Shey, that she will speak up on the different topics now, that how e-learning is going to be in India. Yeah, Shey, welcome.
Hello, thank you. So my friend asked me to speak about e-learning, and how I am familiar with this is because of my background with online business and inside of the corporate world as well, and where everything is moving forward in the future. So not just with COVID, but in general, we have seen that there is a lot more movement towards virtual classrooms. So with virtual classrooms in the business world, I've seen many people, such as nurses. There was somebody that I'm aware of that she started up a nursing program to teach nursing students how to do better in their first and second year of nursing school. So she kind of offers like a tutoring program inside of her community. I also have a friend of mine who's a podcaster, and he has a whole line of medical podcasts. He has a network of medical podcasts where he speaks to medical students who are actually going through the programs today. So this is a form of e-learning. It's not just going onto a computer. It can also be in the form of listening on your iPhones and Androids and listening to free podcasts to get that information. Inside of the corporate America here, we have been going towards having training for quite some time. The HR departments have learned that it's a lot easier to have people inside of a virtual classroom instead of trying to arrange a space inside of the office building and try to find the time that works for everybody and bring them in. it's got a great advantage when you can say, go into this online training program and take these classes that you have to take, and you have to acknowledge you've done these tests. You have to show that you are familiar with the materials. A lot of times the information they're sharing with us has to deal with internet security. We have to take tests a couple times a year to show that we're keeping up with making sure our desktops are secure and making sure that we're not taking home sensitive data from our customers. So we have to go through this training program, we have to acknowledge it, we have to take quizzes, and this has simplified the process for HR, so now that they can see all this information coming through digitally to them without having to have a classroom full of people. So that's how corporate America is working today. And they're expanding that even. Just recently, my company in general, they're trying to help train us to prepare for what's it going to be like when we return to work. I was supposed to return to my office job, my day job, on July 6th. And my company is mainly ran by Indian folks, even here in the United States. And we have a large Indian contingent there. And they're very self-aware and they're trying to make sure that we're following safe guidelines. And as soon as this pandemic began back in March, they told us to all start working from home. And it happened within a week's time. They were able to make everything go digital. I was already working from home 3 days a week. So for me, the transition was pretty simple. But within a week, they realized this was going to be the new normal for quite some time. And they were planning a 5-phase bring back of all the employees starting on Monday or starting Tuesday this coming week. And they've changed that process now. And they said, we realize there's no need to be in a big hurry to bring people back. We have proven that we can do virtual work without any issues. But they also wanted to make sure we were prepared. So they offered this online training course that said, okay, these are the things you're going to have to do once you return to work. So the training included things like how to keep our desks clean, how to keep the social distance, when we should wear a mask. There is one time in particular they want to make sure we wear masks, and that is if we have a stand-up desk, because our cube walls, we might be able to sneeze or cough over the cube wall. We have to have our temperature checked twice a day, once we come in the building and then again during the day. So all these things were required for us to go through on the training process and acknowledge. And they also use a training program to try to figure out who was sick, at what level were they sick, or possibly sick, and try to make sure that they don't bring back people too soon, especially if they have loved ones at home that are immunocompromised. So these are all different ways that we have tried to use e-learning tools in corporate America to work with individuals. Again, going back to the whole business idea, one of the things I do today is I'm a brand ambassador for Fitter. And Fitter is actually a company out of India where we're trying to help encourage people to get healthy by fitness and nutrition. And they are totally an online business. Everything that you work with there, if you decide to learn how to lose weight and you want to start gaining muscle, you do all that through an app, and that's all e-learning. And if you want to enroll with a mentor or a coach, that's all done virtually. I talk to my coach through WhatsApp, and we have all kinds of interactions between each other, and then once a week we have a call. So those are all different types of e-learning that you can consider going forward in the future. Another thing that I wanted to bring up was a lot of, like I said earlier, a lot of the 9-to-5 people are going from their day jobs and taking everything online. They're taking their skills and their knowledge and their hobbies and their passions, and they're saying, I can teach somebody how to do this and I can make a living on this. And they're learning how to create a course and how to build a community around their topics that they're interested in. Right now, the growth potential for e-platforms such as Thinkific and Teachable and Kajabi and Podia, these are all platforms that are online courses that people like me, an entrepreneur, can go out there and load up our courses and hook it up to PayPal and start receiving payments for people to learn how to do whatever it is that we want to share. So there's so many opportunities for e-learning. Today you could go out, you can get ebooks, You can download audiobooks. You can listen to podcasts. Obviously, there's YouTube videos. And if you want a more university style training, you have lots of opportunities to offer quizzes. And I mean, I took a course several years ago all about web design, and that was through an online college, and it taught me all kinds of different skills that I needed to become a better web designer. So there's just so many potential things that can go forward now. And I believe that because of COVID, a lot of people are taking their brick and mortar businesses and taking them online. I think we've got quite a few people talking over here, so I'm just going to go ahead and mute them. So, but basically that's what I wanted to talk to you today about, was just what e-learning, where it's going here in the future, and what will be offered, and what you can look forward to as you continue. Thanks. I'm not sure if we lost him. I'm not seeing him on here anymore. Yeah, he's not on. Let me see if I can try to get him added back into the group. I'm not sure how we're going to get him back in. The group is full, and we're maxed out at 100 people, so I'm not sure how to get him back. I'm trying. Okay, that would be great. Okay, I'll try. I sent him a message to rejoin. He hasn't seen my message yet. Okay. Not yet. Okay, that'd be great.
Ma'am, your voice is audible. You can continue, ma'am.
I can try. What else would you like to know? Well, what we're having to do here in the United States is, we have to do social distancing. We didn't have the lockdown here like what you have in India. So we have to wear masks in certain places, but it's not required. There's a lot of controversy whether or not masks are necessary or if they're even healthy for people to wear. So there's a lot, it's kind of tough right now. You go into a gas station, a petrol station, I guess for you guys, and you have to stand behind a line that they put on the floor. And then we have plexiglass that keeps us away from the person working behind the counter. And of course, we have lots of hand sanitizer. I see hand sanitizer everywhere now when I go into any kind of business, which is awesome. I had to go to a doctor's appointment this past week to have my knee looked at, and they're keeping all of the sicker patients, people that have a fever, a cough, anything that might resemble COVID, they're keeping them outside in a separate location so that they can be treated separately and not bring it into the main clinic and hospital area. But to come in, everybody was wearing masks. They had 2 people checking your temperature. They made you answer a bunch of questions to see, like, have you been around anybody with COVID? Have you had any sickness? Have you been outside of the state? I mean, there's lots of questions that they're asking, which will be similar to what my employer will do when we return as well. And then they check your temperature, and if you're okay, then they will let you go proceed to your doctor's appointment. And our stores have all implemented like one-way walking to get to buy your products. And then they're wiping down all of our shopping carts. So when you go to pick up a cart to go buy your groceries, everything's already wiped down for you. And like I said, we have wide open spaces here, so we can do a lot of social distancing pretty easily. And we just try to encourage everybody to keep at least 6 feet apart from each other, so you're not breathing on somebody else. And that's kind of what we're doing these days. I see he's finally able to rejoin, so I can let him take over from here and carry on with his session.
Okay. Yeah, thanks, Shey. Thanks for your presence here. Yeah. So I would like to thank everyone for being present here and for taking some spare time from your precious time. And I wish that you stay safe with your family, stay happy, and don't forget, stay digital also. Try to avoid going places. Just try to avoid places with rush. And I hope that you have enjoyed the session. And thank you, Shey. Thank you, Abhimanyu. I would like to thank to the whole team members. Yeah. Shey, are you there?
Yes, I'm still here.
Yeah, we can have some questions.
Hello. Hello.
Hello, we can hear you. Go ahead.
I'm Dr. Deepak Parashar from India. I just want to know one thing, that in USA the goggles are also mandatory along with the masks.
Yeah, Shey, it's for you.
I didn't catch that first part. I heard something about masks.
Shey,
what was that first part?
He was saying, Deepak, let me elaborate.
Okay.
Shey, he was saying that are goggles also mandatory in the USA with masks?
To cover the eyes? Is that what you're asking?
Yeah.
No, the only thing we've been required to wear is a mask that covers the nose and the mouth. That's the main thing.
Okay. Because in one of the journal I have studied that the virus can enter through the eyes also. That is the Journal of Epidemics.
Yeah, I've heard that. They haven't required us to wear, like I said, they don't even require us to wear masks everywhere. It's kind of state by state basis and even store by store. I was just reading on Facebook before we started this webinar, there are some people that are very outraged that they feel like they have to wear masks. People aren't ready to accept that there's actually a pandemic. I think a lot of people are still in denial that this even exists. And it's very confusing and frustrating, but like I said, people don't know why they need to wear masks. They don't know if they're doing it to protect themselves or if they're trying to do it to prevent the spread to other people. And I've heard about the eyes, that it makes sense that would be an easy way to contract the virus, but they're not telling us to wear goggles, glasses, or anything.
Okay, thank you, sir.
Sure.
Yeah. Yeah, is it for Shey? Is it for me? Okay, Shey.
I'm not sure I'm the best one to answer the herd immunity question. That's kind of a little bit out of my expertise, so I will refer to you guys to answer that.
Yeah, so guys, let me tell you what is herd immunity. Herd immunity means our body can tackle with the different viruses and the different, with the different diseases in our body. Means we have to our body, the organs of our body must be strong to tackle. Means if a person often gets easily contacted with any disease, any virus like cough, cold, whatever, means some people are sensitive. They have very sensitive, very sensitive organs. They have a sensitive respiratory system. They easily get contacted with such diseases. So it means that they do not have herd immunity. Yeah, good afternoon, Rahul Dev. So they don't have herd immunity. Herd immunity, how we can achieve the herd immunity is we have some points here. We can drink a lot of water. We can avoid junk food. We can avoid oily food, especially in India. We eat a lot of oily food. Shey, Sonia, Narwal. Yeah, thank you, Sonia. So this is what I was saying about herd immunity, and it can be achieved automatically by our body also, because once we get contacted in this disease once in our life, then there's no chance to get contacted with disease again in our life, because we will get antibodies in our body. Yeah.
Mm-hmm. Mm-hmm. Yes, it's very important to keep our health in mind by eating the right foods. At Fitter, they really want you to eat clean, healthy foods, meaning not processed. So the closer you can get your food to be to the original source, like eating potatoes, eating tomatoes, eating onions, and not eating processed food that you buy in the store that's already packaged together, especially with a lot of sugar and a lot of fat. You want to make sure that you're eating clean. And it's also important that you exercise. The exercise and eating clean, following a good diet, if you can quantify your nutrition, count your calories, pay attention to how much fat and how much proteins and how many carbohydrates you're getting, these things can help lower the body fat that you have. And hopefully this is still kind of being studied, and there have been people, I just found out from one of the founders of Fitter today. He was telling me that one of his clients who lives here in the United States, he contracted COVID a few weeks ago, and he was intubated, and he's in his 20s. And he said that when he first started getting sick, he thought he had the flu, and the next day he got a really bad sore throat. And then he got really bad and he couldn't breathe, so he had to go to the hospital and get intubated. Luckily for him, he recovered. And, it could be because he was transforming his life. He was eating healthier and doing the right things. But the other thing that the founder told me was that just because people are starting to exercise now and starting to watch what they eat now, it may be a little late if they catch the virus right away. So it's something you want to make sure you start trying to eat properly and exercise properly now, because if the virus decides to come back even stronger with a second wave, like some people have predicted, maybe that will give your body a fighting chance to try to, hopefully keep your immunity up and your resistance strong so that you don't get sick as well. Is that for me?
Yeah. Let me tell you. See, Arpita. See, yes, it is going to affect our economy, because when economy of a country goes up, when the people of that country spend their money to buy goods or whatever they are going to buy in that country. But now in this pandemic, our automobile sector, no one is going to buy, the numbers have decreased a lot. No one is going to buy bikes, automobiles, whatever. And we can think this thing from ourselves also, as we can see, we are just purchasing the things which are essential for us. So yes, it is going to slow down our economy, but still, if I speak 2 days back, every country, if I saw a chart that was of US, China, Germany, and some other countries. So our GDP is 2%. And if I talk about the GDP of USA and other countries, they are in the minus during this pandemic. So we have to congratulate ourselves that yes, we are going to achieve a J curve in our economy very soon.
Well, from trying to right. I mean, even for somebody like me who's middle aged, trust me, I worry about this stuff too, and I want to stay healthy. And my parents are in their middle 80s, and I haven't seen my parents since the pandemic began. I missed Mother's Day, I've missed Easter, I missed the holidays with my family. And the best thing that we can do is just to make sure right now, if we can not visit them, then unless it's virtual, get on a computer and watch them like you're doing here with a Zoom call, which is really difficult. And I've seen a lot of people here in the United States where they will pull their car up in the driveway of the house, and the parents will be there in the yard, but they'll keep 20 feet apart just so they can at least visit with their family members. And it's really the best thing we can do. And if you are going to be around some elderly people, wear a mask because you're protecting them if you might be a person that's carrying the virus and you don't know it yet.
Hello, I have one question. Mr. Aditya.
Yeah. Mm-hmm. Yeah. See, it's a very nice question. Thank you. See, right now our education system is going good with the digital education, as you know very well. Your teachers, your schools, your other colleges, they're giving online classes, but it is not possible to take online tests, as you know very well, because it might not give a kind of transparency which is required for the exams. But what if I can see here, like we can have examination with proper social distancing. Scanning must be done in the colleges, in the examination halls. The necessary examination we can have. I'm not saying about every year. I'm just saying about the final year students. Those are in the final year in their final semester. So their exam can be conducted. In my opinion, I can just give an opinion here. I'm not an authority here to conduct the examinations. And there was another question from Deepika Thakur. Deepika, can you hear me? Deepika asked a question. Was the fault of human? Yes, of course. The human is the only creature in this world who wants to destroy its habitat. Human is the only creature in this world who wants to destroy its habitat. We got different diseases from the animals because we eat animals. Whenever I think any animal, when I don't think cute, I don't think delicious, I think a virus, because they contains thousands of viruses. A meat contains thousands of viruses. So what we have to do from now onwards, we have to start eating vegetarian food. There are plenty of nutrients in the vegetable food, and we have to encourage ourselves and the people in the society, in the community who are consuming non-veg foods, that we have to start eating veg food. Yet, yes, it is the fault of humans.
Hello.
Yes.
Myself,
Guys,
Dr.
please
Nasir
try.
Faruqi.
Please try. Do one thing. Try to speak one person at a time.
Dr. Nasir. My question is, China and Germany is claiming that they are manufactured the vaccine for the corona, but why they did not supply to other countries?
See, Dr. Nasruddin, whatever his name is, it has not been confirmed yet. We don't know still that the vaccine has been made or not. It's not possible, like, to say, it's not the right time to say that yes, we have the vaccine. They are just trying, and I don't think so that any human trial has been done yet in Germany. I can't say about China because they keep everything confidential. But if I speak about Germany, so I don't think so that they have prepared for the vaccine. As I've heard about the president's notice before 30 days back, he was saying that we are planning to open the schools and colleges very soon because we have increased the testing ratio. They have increased 1 month back. So might be they are going to tackle with this problem.
Yes, Mr. Aditya, is it safe to use
Yes.
car AC nowadays?
Car AC can be used, but we should avoid going to the places which contain centralized AC. Okay, because in car we are 2 or 3 people. Okay, and we know who is
Otherwise,
suffering from
AC is
corona.
safe.
Yeah, otherwise it is safe. You can use it at your home, you can use it in your car, but you have to try avoiding to go such places which contain centralized AC, like banks or big halls, and wherever the centralized AC is used, because you don't know who the person is affected in the another room next to you. You don't know that, so you have to
Yes.
avoid that.
Thank you.
You're welcome. Hmm. Yes. Uh, Okay, Shama, this is a very nice question which you have asked. Nowadays, it is very popular. In US, in Germany, the e-learning has been started years back. Okay, when we did not have good internet, they have started the e-learning, and they are giving a good scope to their students nowadays. Okay, but in India, if I talk, I have seen some students, they just switch on the video, they don't watch it properly. So it's up to them that what they are watching. But if I speak about a great person, Elon Musk, he's a great businessman of the world. He said one thing in his book, he has written one thing in his book, that it is not necessary for a human to go in an institution, to go in a school to study. He can study from everywhere in the world. If he can have a good knowledge, he will get a new good knowledge. So it can be taken from the e-learning. And if I talk about the eyes, so it is a very stupid thing to say that yes, it has a very bad effect on their eyes, because everyone knows if we use anything in excess. So, but people don't ask such questions whenever they use Hotstar, whenever they use Netflix or any other things, whenever they use Facebook. So, guys, please invest your time in learning. Please choose education over entertainment. Please don't choose entertainment over education. Thank you. Mm-hmm. 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 Yes, yes, of course. See, if I speak about the World Health Organization, they have recommended that we have to use N95 mask, but it is not possible for everyone to buy N95 mask every day. So what we can do is we can simply cover our face from a piece of cloth. We can use simplify the homemade mask. It is okay to use, because we have to protect ourselves either from N95 or from the any other mask. N95 masks are to be used by the doctors, because they take samples and they cure patients. Yeah. See, well, yeah, it's a good question, but see, it's not easy to say now. We can. It's a bitter truth. There is not any clue which we have that we can make a vaccine. See, it's a simple thing. What vaccine will do? You are medical people. Okay, you are from medical field. What vaccine will do? Is it going to improve our immune system, or is it going to improve our organs in our body? I'm not sure about that, because I'm not expertise for this. But I just want to say that you don't have to rely on the vaccine, that vaccine will come or not. We just have to improve our immunity. We just have to take care of ourselves, our family. That's all I can say. I can't say anything about the vaccination yet.
Uh, Hello, Abhimanyu. I have a question.
Mm-hmm.
Dr. Deepika. Sir, I just wanted to know that again and again we are saying that we have to maintain our immunity. And when we talk about infants, there are very limited options for them. So, what should
Yes.
we do with the infants to increase their immunity?
Uh, well, it's a very, very nice question you have asked. See, I think you are a mother. Hello.
Yes, sir. Yes, sir. I
Yeah.
have a
So,
10-month old daughter.
Mhm. So as we know that there are very less options for the infants to eat, to take the things, and it is not possible to improve their immunity right now. But for your knowledge, I would like to tell you that an infant has a good immune system. Okay, I'm not saying
Okay.
anything about like certified, this is not certified or not. I'm not saying, because it is medical is not my field. I'm just giving you the answers based on my knowledge, whatever the knowledge I have. But in my
Okay.
opinion, I think that infants do have good immune system. Okay, some infants don't have. They might get any kind of disease easily. It's possible, but the only thing we can do right now is we have to protect them. Okay, we have to avoid doctors, we have to avoid OPDs. We should stop going doctors for the small diseases.
Yes, sir. Yes.
Mhm.
Okay. Thank you.
Yeah, welcome. There are some other questions here. Let me read. See, Sushma Agarwal asked a good question. In online classes, students living in remote areas having net issues cannot attend the classes, and they are getting loose in their studies. Okay, Sushma, it's a very good question you have asked. See, there was a thing happening before COVID. Teachers were giving assignments to the students. They were just writing. See, I really don't like the system of education in India, because from the first class to the last class, students are doing one thing. They are just writing and learning. Is it education? I don't think so. It is education. So, guys, if you are really willing to learn, if you are really trying to be something in your life, if you are trying to really trying to be informative person in your life, you don't need any class from anyone. In my opinion, I don't think so you need any class. Sometimes you need. It's not easy to say that you don't need, but if you cannot attend your classes online, you can just do one thing. You can ask your classmates to record the session, and they can send you the video. If you are not able to attend the classes online, this is the best solution which I can give you.
Hello, sir.
Yeah.
Hello.
Yes.
Myself is Dr. Sushma Agarwal. Sir, but they
Yes.
have a net issue. They can't receive the videos also, no?
See, that is what I'm saying. I'm from engineering background also. See, the video can be downloaded throughout the night. If you start downloading it at night, it will be downloaded till morning. Okay, but there are such people in India, poor people in India, who don't even have mobile phones. We are talking here about the
Sure.
network.
So
They
many,
don't have mobile
so
phones
many.
even. So
This
let
is
me
a
tell you
problem
one thing.
also.
Let me tell you one thing. As I know about the government of Haryana, we have around 30 channels, informative channels of Haryana, where the classes
Okay.
are being given by the government teachers. So if you can check online, you will find over there that on TV also students can get their classes.
Okay. Can you send the link, sir?
Yeah.
Can you send the link?
I'll try
Okay,
to
sir.
find out that, and also this is my suggestion for the government, that they have to start classes on TV.
Thank you very much, sir.
Welcome. Mhm. Welcome. Thank you everyone for being here. You're welcome. Thank you. Thank you so much. Mhm. Thank you, sir. Thank you. It's my pleasure. Yes, yes. Thank you, everyone. Thank you, everyone. Thank you, Subhash. Thank you, Deepika. Thank you, Komal. Thank you, Seema. Yeah. Yes, Deepika, we are going to conduct very soon. No problem. And a special, guys, you have to just yeah. Just a second, Mr. Abhimanyu. Guys, please do not give a thank you to me, because you should thank to your college, to the organization, that they invited us for this session. Okay, thank you to them also, and thank you all of you that you are here. You showed your presence. Thank you. Okay.
Thanks for having me.
Okay. Thank you, Shay. Bye bye.
Yep.
Have a nice
Yep.
time. Stay safe.